prevention people who go in the field and do inspections every day for their hard work, their good work ethic, their knowledge, their professionalism, and many times their personal bravery. I can't say enough about these guys. I think we got the best employees in the world, and I'm not going to miss an opportunity like this not to say that, because it's true. All of these folks together, they help create a safe environment for Nashvillians, create a safe environment for people to live here, to work here, and to visit. We see this as an ominous task, but an honorable one at the same time, and we're going to continue to do that no matter what our budget is, to the best of our ability. I also want to thank the management team. We have several of our deputy directors and all of our commanders in the back. This is the management team. You may hear me say I quite a bit tonight, but I don't have that kind of ego. These folks back here are the ones that make the wheels turn. I'm going to give you a couple of just real brief statistics. In FY15, that's just the last FY that we've completed, that we have complete data on, we had over 100,000 requests for our services from taxpayers. About 20% of those requests for services were for fire-related calls, fire suppression calls, and approximately another 80% were for emergency medical services calls. And we transported approximately 60,000 people during this same time frame. The point I'm trying to make here is we are a busy department. We're busy, we're a large department, and just like every other department that serves Metro, spatially, we're spread out over quite a large landmass. On February 6, 2013, Maximus Consulting Services issued a report on the Nashville Fire Department, and that report is titled Fire Department Management Analysis. I won't go through the whole report. I'm going to talk about a few of the high points here later. But the gist of that report is the reality in 2014. As public servants, we're going to be required, and we are going to do more with less. That's the bottom line. Just some of the highlights in the report, it recommended the streamlining of management. We've already started to do this. I think 77 people in the fire department took the buyout last year. Several of those were, I want to say, higher paid jobs within the department. And what we've done is, rather than replace some of these higher paid administrative positions, non-field chief positions, we've carved those positions up into smaller pieces so we can put more foot soldiers on the street. We don't automatically use those vacated monies, is what I'm saying. By using several vacated administrative positions, we hired 20 paramedics to put more ambulances on the street, which is a real good segue for another major point that they brought up. We need more medic units, more ambulances serving the population of this city and for this large spatial area. One thing that I read in the Maximus Report that really caught my eye, and it was a citation from the University of Tennessee Center for Business and Economic Research, and it estimates that the over 65 population in Nashville is going to grow by 64% between the years of 2010 and 2025. We're already 4 years into that 15-year span right there. So we're seeing these increases as we go. I doubt if we'll ever get ahead of the curve on that, but when you look at 64% of our population aging over 65, and you see approximately in the same report an additional 14% people moving into this area, the writing's on the wall. We're going to have to keep providing these increased medical services. Before the start of FY14, we grew our field ambulances from 19 static units to 22. This accommodates a 15% increase in services. And quite frankly, like I said, we were 4 years into this 15-year span. They've been swallowed up. And if we hadn't had them, I don't know what we would have done. But they have been swallowed up. And we're resolute in trying to provide more of these services. It recommended developing an internal affairs function within the fire department. And the way we accommodated this is we have arson investigators that are trained in investigation, trained in questioning, interrogation. And we just thought this was a natural area to handle this internal affairs section. Once again, though, going back to doing more with less, the arson investigators' workload hasn't lessened, but they're doing more. And that's our call to duty right now. talk about, or it recommended increasing communication between the various divisions and functions within the department. When I came on this job, we had an EMS division, we had a fire division, and we had fire prevention, or administrative rather. Those are the three big areas. As we speak today, we have a EMS operations function, we have a fire operations function. They report to one deputy director over operations. So we have collapsed two high-paid positions into one, and just out of necessity of reporting this same person. This is, I'm not going to say forced, we've done this willingly, but there's much greater communication between field personnel, staff personnel, and everything in the two biggest branches in the Nashville Fire Department, and we're very proud of that. There was a recommendation in the Maximus Report for increasing the efficiency in both fire inspections and development function within the Fire Prevention Bureau. One thing we've done, I know you've heard about the one-stop shop over at Codes and everything, and we've actually moved our plans review section from Fire Headquarters at 63 Hermitage over there with Codes. Well, why do we do this? Well, it's better customer service. Taxpayers are why we exist, and the least we can do is accommodate them every way we can. You no longer have to go to two separate facilities to get similar paperwork, one from fire and one from code. So once again, this is something we're very proud of. Another way that we've increased efficiency in the field as far as our fire inspectors are concerned is something pretty simple, is just issue them with a computer tablet. Now in the past, a fire inspector would go out and inspect a property. They'd take written notes, maybe use a checkoff sheet or something like that. Then before the end of business day, come back into the office and physically enter that material into their computer. With these PC laptops, or PC tablets rather, they're going out in the field, and the fire report or the inspection report is on that tablet. So what they're doing is they're filling out that inspection report. When they do come back to the office before the end of the business day, they're not physically re-entering this data. It's actually just uploading to their computer. What does this mean to the taxpayers? We're increasing efficiency. We're keeping people out of the office that are needed out in the streets to do these inspections. And so, you know, we've cut back on the administrative time, which is going to give us more inspection time. There's a recommendation to continue to build upon our an already efficient and professional arson investigation unit, and we do this constantly. We're trying to make more training available to these guys, some more equipment that's going to make them much more efficient in their tasks. But right now we do have an efficient and professional unit in the field out there. I don't know if you know, but the arson investigators, they work pretty closely with the DA, and in the past the DA and our arson investigators have had pretty good conversations and a lot of respect for one another. Okay, I'm going to change gears here a little bit. In FY 2012, the fire department hired 35 new recruits under what's called the SAFER grant. SAFER stands for Staffing for Adequate Fire and Emergency Response. It's a FEMA grant, FEMA issued grant. And we were able to acquire 35 new hires, which we ran through our training academy during that time frame. Now, in 2015, the salaries and fringe must be absorbed by our budget. So consequentially, we're having to absorb those 35 positions according to the SAFER guidelines. The feds are no longer paying for those salaries, and we're prepared to do that. We got a few goals for FY15. I don't know how much EMS expansion we're going to do, but any time that we can save a penny, we're going to put it in the bank to expand those EMS services. We have in our plans to upgrade various safety items for our personnel. The rationale being, first of all, it's the right thing to do, but the real rationale, if we can't keep our personnel safe, what chance have we got of keeping the rest of the city safe? So we're committed to that. And also, we're wanting to upgrade our fleet status. Now, we've been working with General Services and the Office of Fleet Management, and once again, at the risk of maybe being too gratuitous, I have to thank Deputy Mayor Highnote, Finance Director Reebley, because they're the ones that were instrumental in making this happen. And I'm never going to forget this council because you actually voted on that, and we're very appreciative for that. I'll conclude this in just a minute, but I just want to tell you a little bit about myself. I've been on this job 36 years, most of that time in the field. I've held every rank in the department up to and including assistant chief in this rank now. I'm a native Nashvilleian. I grew up in South Nashville, educated in public schools here. What am I getting at? I love this city, and I love this department. And all the folks I work with feel the same. And we will do everything we can to keep this city safe and protected. I'll entertain any questions now.
Thank you, Chief. Let's begin with actually sort of breaking my own rule. Because we don't have a special opportunity to talk to you about the capital budget, but this council is very interested in the capital improvements in the fire department. I think there's $12 million in capital improvements in the capital spending plan. Can you all address exactly what that will do for the fire department?
I'm going to start out, and then I'll let Leanne take over with the financial aspect of it. Big plans are to do some improvements to our training academy, possibly build some new stations. We're not really sure where the stations are going to go, when they're going to go. There's an analysis process that we go through, basically gap analysis, to find out where we need these improvements. A lot of things go into the selection of a site for a fire station. It's very analytical, and we've got the people in the right place to do that. As far as the financial aspect of it, Leanne, do you want to talk to that?
The only thing I'd like to add to what Chief White has mentioned is within that $12 million, we're going to look at additional fire stations, but we're also looking at replacement of equipment as well. One of Chief White's key elements is making sure that our uniformed personnel have the proper self-contained breathing apparatus, and this is one funding source that we have to make sure that we get them outfitted with the appropriate equipment.
Will this cover the mini pumpers?
I think that's actually coming out of the 4% bond issue, isn't it?
I was just curious, just again, proving I listened in your presentation to the mayor. You were very articulate on the subject of mini pumpers. So, Councilman Claiborne.
Thank you, Chief. You answered one of my questions about the federal new hires and that they're being absorbed this year. The other question I had on, you mentioned about ambulances and need for more. Are we adding any more EMTs, any more ambulances this coming year to what we currently have? And if so, how many?
Right now, we can't give you a correct figure on that. All I'm saying is we're going to do everything we can. That is our mission. Now, dollars are going to decide that, obviously. But one thing that we've done in the past that also, I guess this goes into communication between the various entities in the department. When a recruit comes out of our fire academy now, they're trained as a firefighter and they're trained as an EMT. In the past, they either got dedicated to EMS or they got dedicated to fire. What we're trying to do is keep our dollars available on EMS to hire paramedics. EMTs are very vital, but as far as operating advanced life support ambulance, which we like to operate, you need one EMT and one paramedic. So what we do when a person comes out of the academy now, we'll look at maybe 25 or 30% of their class. They'll be assigned to EMS for 6 months. They'll rotate back into fire for a year, and we just continue doing this with the class. Right now, we call these rotational assignment personnel. Right now, we have 90 on the books that are doing this constant rotation between EMS and fire. It makes for better communication. There's more empathy for one another's job, and I think our EMTs now are becoming more proficient through the fact that they're on these medic units.
Okay, thank you. Can you give us some idea about the timeline for the new equipment rollout, when that'll start and how it'll progress along?
Yeah, we've done our due diligence on this as far as speccing out this equipment. Now, we're working with General Services, but we want to make sure that we get a good, safe piece of equipment, and we want to get that good, safe, functional piece of equipment at the best price. So there's, I won't say tire kicking, but there's a lot of analysis going into this, and we're trying to get these units down to where we can buy more of them. If we can get them at a lower price and they fit our needs, then we can pick more up. As far as the timeline on that, we'll be ordering these or getting the specs over to fleet. I've been promised by Friday of this week, no later. And then it's usually sometimes up to a year process of actually getting them in the field.
That was my next question. we realistically expect to see any new equipment on the road in this coming fiscal year?
Well, I think we're going to see some new ambulances, I know now. We had previously ordered an aerial device, a truck, and it came down the fleet, and I think the check engine light was on, so it's back at the dealer getting that fixed and everything. But they're going to start trickling in, yes, sir.
Okay. And then just one other question, and I hear this sometimes when I'm visiting in fire halls. Is there ever a discussion about going back to in-house maintenance?
I guess you're talking about not subcontracting out the repairs and things?
Rather than doing it at the main garage.
You're talking about as far as fleet is concerned?
Yeah, right.
I'm sure there's all kinds of discussion within fire stations about it, yes, sir. I think the infrastructure cost would be so overwhelming as something that we couldn't look at, though. And, you know, we've got an aging fleet and everything, and we're trying to do things to save on wear and tear on new pieces of equipment. But I think the matter, if we get the new equipment in here, we'll get the service we need. It's just that when so many of your pieces of equipment have over 100,000 miles on it, well, it keeps the guys over at Fleet pretty busy, you know?
Right.
And I think they're doing a good job for us myself.
I guess my next question I'll just reserve for our next guest up front. Thank you.
All right.
Councilwoman Berry.
Thank you, Chair, and thank you, Chief, for being here. I really appreciate it. This actually is a question more around staffing, and this has been a conversation that's been ongoing the last couple of budget cycles, and that is being able to make sure that we are appropriately putting the number of people that need to be on a fire engine or in an ambulance and running those crews at the right amount of personal staffing. Can you talk a bit about that? Do you feel comfortable with where we are, or is that something that we still need to talk about?
Ma'am, I don't think there's a fire chief in the nation that would say they wouldn't like to have more people on these units. Right now, certain units do run around the clock with 4 people. Very few of those do. Usually that's our rescue units, our special operations units. The rank and file, depending upon how many people are taking off on vacation, times of the season and stuff like that, then we generally run those with 3 people. We'd like to have more, but we've got this split in services that we have to accommodate. And you know, I was a non-practicing EMT for years and years, but I never served in the EMS division. But I understand I think we're going to get steamrollered if we don't continue to add to that fleet. And I would love to do it with both of them. But right now, we've established priorities. And Fire Chief's worst nightmare is one of your people getting hurt.
Right. Thank you.
Councilman Tiger.
Thank you. Councilman Claiborne touched on the fleet issue, because we do hear that trucks are, stay in the garage an extraordinarily long period of time based on their specialty of equipment, and we want to make sure we can get those back out in the field on a timely basis.
Right.
Question, I don't know if this is for you or Leanne. Why are we projecting $300,000 less income, charges, fees, and commissions this year than last?
Thank you very much for asking that. Over the past 3 years, the department has noticed a significant decline in EMS revenue collections. We feel that is primarily due to a Medicare prepayment audit that we're under, and this is not something that's just applicable to Nashville. There are other entities throughout the government or throughout the United States. Each of those Medicare claims go through an extensive audit before they're ever released for payment, and it puts a significant delay in the time for us to get the money back.
Will we eventually get that money? It's just hung up in the system?
No, not always. There are a lot of denials.
So the bureaucracy is kicked in, basically?
Yes, sir.
At one point, we employed a collection agency to help with some of the past due bills. Do we still use that service, or where do we stand on back collections?
We do. We have one company that actually does the initial billings for us, and then we have a second service that does the bad debt collections. And that contract was recently awarded to a new company.
Better terms, better promises? Or is this similar to our property, the way we handle property taxes, or is this just a percentage of collections, or?
They don't serve just the fire department. It's a metro-wide contract.
Leanne's right. It's a metro-wide. We went out for proposals, got a new firm back, and yeah, they're going to take less percentage, which means we would get more of the collections. And obviously, hopefully, they'll be more successful. We'll collect more money.
What other departments are affected with this contract?
I think everybody in Metro, everybody in the government who, I'm trying to think who else has collection.
I was going to ask, which departments would be more vulnerable to bad collect or bad debt?
Fire would be the most because of the ambulance is probably the largest. Who else? Well, would it be the court cases? So you'd have all those on collections. And I can't think of anybody else. Those are probably the most ones.
So what do you expect the increase in overall government revenue based on the more favorable contract?
I don't have that number. I can look for it. I don't have
Talia, with her brilliance, could probably know that off the top of her head.
I would think she would.
I may go wake her up then.
Councilman Pardue, and we are delighted that you're feeling better.
Thank you, sir. I appreciate that. But with me laying at home on the couch with a pack of cigarettes and a cup of coffee, a cell phone, and all the medication you need,
That's supposed to make us more or less sympathetic.
Thank you. Well, I've laid around and came up with some numbers that has shocked me, and I hope I'm wrong about them. But I went back to when I came on the police department back in the olden days, as my daughter says. It looks to me like we're about 400 firefighters short now than we was in 1980. Now, I don't know if you have those numbers available with you or not, but is that possible?
I wouldn't think the number would be that great. But I'm trying to remember when I came on in 1978, I think fire suppression had maybe 975 or 1,000 personnel. Now, one thing you have to remember, though, we've opened up a lot of stations, and we've also reduced the staffing on many of the units. So I wouldn't think the numbers would be that depleted, but I could very easily be wrong. Have you got any back information like that?
That's okay, Chief. Just
I don't have anything
if you run across a number like that, I'd appreciate it if you'd let me know if I was right or wrong.
Sir. I'll make sure you get that.
But it shocks me that, I know you've spread people out a lot, but the county hadn't got no bigger. Got a whole lot more people, and I see where you answered 100,000 calls for service last year.
Right.
Compare that to 85 or whatever. If it's true that even if we're 300 short, it looks like we're probably the first major fire department that's going to go out of business. If this is the case, we're going backwards. I don't understand that. And one more question: the 1.5 increment that Rich said is in the budget. Now, is that in the budget specifically for their increment, or is it up to you as the fire chief now where that money goes?
Hold on, Mr. Cooper.
We've got the increment for all employees who are due an increment, and then on top of that, you've got a 1.5% across the board raise that would take effect January 1st. 1%. I'm sorry, it was 1.5% last year. 1% across the board that would take effect January 1st. So they would get the increment plus that 1%.
All right, and I've just got one more question, Chief. The steeplechase this year, I understand a fellow that lives in my area out there, that said they had a fire at the steeplechase, that we may have been able to save that building if, like the police department, I don't know where their funding comes from for their special events and stuff like that. Do y'all have a special events section?
We don't have a dedicated special events section, no, sir.
Okay, so like at the steeplechase, we wouldn't have any firemen assigned out there or working?
No, sir, that doesn't mean that we don't necessarily work on special events. I mean, we got July 4th coming up. We'll have 90 people down there, not including some of our commanders and everything operating in within the instant command function. You know, we got CMA coming up. We'll be actively working with that. But it just depends on the event, to be honest with you. And I'm not familiar with any of our personnel that were assigned to the steeplechase.
Okay. Now, how does that affect your staffing if you have to send people to CMA, or does that mean you have to close some fire halls and move people around, or?
No, sir, we're not going to close a fire station to do that. And generally speaking, if we have the money in our overtime budget, we may pay some overtime to do that. Now, if one thing we've been discussing with July 4th, for some reason or another, we have a lot of our employees that work on holidays. And, you know, if we have I'm not going to say an excess, but a real overage of our bottom line, the minimum number it takes, you know, we may save on some of our overtime by utilizing some of those personnel. That's not etched in stone. I wish we had a special events budget, wish we had more money for it. But we try to accommodate people as best we can right now.
Okay. Well, that's all I have. If you don't mind, if you'll check that number that I said, but it may be way higher than.
No, I think I've got some personal records at my house in the office that I can dig that out of.
All right, thank you, sir.
Thank you, sir.
Councilman Langster.
Thank you, Mr. Chair. If I could take a moment of personal privilege here. Chief, I want to say thank you very much for engine company number 11. And before your arrival, I was on Deputy Mayor Hinote's list of calls weekly, not daily, but weekly, almost daily. And also Rich Reebland, the finance director. I worried these two gentlemen about this fire hall, and it came true for real. The mayor and I were both there for the ribbon cutting, and I want to thank you for while you were rising up to this position where you are now. I was really on high note and Rich Reebland's telephone list every day, but I do thank you for the manner in which you got it open. It was really a first-class opening, and the community is really enjoying it. August the 5th, Night Out Against Crime, we will be in that fire hall with your permission. Thank you very much.
Lady Langster, we'd like to get those phone numbers as well, so the rest of us can use them too. Councilman Bedney.
I'll take the numbers too. Well, first of all, thank you for your service. My house burned some years ago, and I benefited from the excellent services of the fire department, and so I'm personal witness of the good services that you all provide. I wanted to ask a couple of questions and a follow-up question. So the first one is, when we send an ambulance, when somebody calls with the need of an ambulance, do we have a different tier system to where, for example, if somebody doesn't have a car and is in need to get to the hospital, but it doesn't require emergency services, do we have a way to transport that person to the hospital without having to send an ambulance to see them?
Presently, sir, no, we don't.
Okay, so can you run some numbers to me and for me and let me know if there is a possibility to create a two-tier system where we might have some kind of a transportation system that doesn't require to have all the equipment for treating somebody, but it will save the city and the person that is being transported money. So it'll be something where somebody maybe calling instead of 911, he calls the regular police number to get transportation to the hospital if they need to go there. Right now, I believe that when people need to get to the hospital, they just call for an ambulance regardless of the gravity of the situation.
That, in many cases, that's true, not all cases, obviously. But I guess for the last 20, 25 years, there's been discussions within the fire department how to best do this. And I guess one of the things in public service, and especially being professional healthcare providers, you're always sometimes people will call for a service and maybe they don't look sick, and then 5 minutes later they're having a heart attack. So that's kind of the ins and outs that we have to look at. I think it's something worthy of looking at, and I'll try to get you the information you require, sir.
Yeah, because if it doesn't save any money, then, but I don't want to save money on somebody's health situation, so I appreciate you making that comment.
Well, it wouldn't, it's not just a money thing, if we had some way of transporting people, for lack of a better term, of providing a taxi service or something, it would free up those medic units for true healthcare emergencies.
All right,
I'll be glad to get you that information.
Thank you, sir.
Yes, sir.
The other question is, how do I get a fire station in my district?
I believe Engine 6 is in your district, is that correct?
Well, the problem is, and I know Mr. Stein doesn't like me to get personal, but the question is, many of the people in my district got their insurance increase because they, according to the insurance company, they are not getting the coverage they need. So how can we work with the insurance company to deal with that issue, or how do we get a fire station? We just need I look forward to your leadership on this. Help me. I mean,
it's just another challenge, Councilman.
Yeah. Well, let's challenge it together. How about that?
I'll be glad to sit down and talk with you, sir.
Thank you, sir.
Yes, sir.
Councilman, I think you need those phone numbers from Ms. Langster on that issue. Councilman Holloman.
Thank you, Mr. Chairman. A couple questions, and I know that we had talked a little bit about the longevity pay. And could you explain, I think I understand correctly that we have a program with firefighters similar to the COPS program where we received some federal funds a few years back to add on some firefighters. Could you, I guess, explain to us how that's going to impact this budget or not?
Yes, sir. That was what I mentioned earlier. In 2012, FY 2012, we hired 35 firefighters under the SAFER grant program, which is Staffing for Adequate Fire and Emergency Response. And in 2015, the Fed payout on that is over, and the fire department picks it up. So basically, in compliance with the SAFER rules, SAFER conditions, then we'll be obligated to pick those salaries up.
Okay, and exactly, I guess, how does that impact? I know that we have the buyout program, and how do those two intersect? Can you explain that to us? Or I don't know, Leanne, can one of you explain?
Yeah, I might let Leanne explain that. She did some wizardry with our buyout, by the way.
In fiscal year 13, we had 77 employees, as Chief White mentioned, that took the buyout. The first 35 vacancies that we achieved through that buyout, we put to the side and reserved them so that we could absorb the 35 SAFER grant employees.
Okay, and so we're not asking for any additional funds in this budget to cover that? That's just something that's been built in. Are we holding those positions until the buyout is complete? Is that correct?
Correct. When the buyout occurred in fiscal year 13, we fully recovered the $3.2 million that it cost for us to pay out all those employees, and we did that before the fiscal year ended. So we just continue to sit on those positions until the grant expires in fiscal year 15.
Okay, so in other words, we will have received these federal funds, been able to use them to leverage additional positions, but we're not going to have a local obligation because we're going to hold those positions until the grant term expires. Is that
That is
fair summary?
correct.
Okay, thank you.
Councilman Baker.
Thank you, Chief. I had some questions I was going to ask, but they've already been asked and answered, so I appreciate the work that y'all do, and appreciate all the gentlemen here in the back, the chiefs and all. You do a great job. Thanks.
Thank you, Councilman.
With that, Chief, thank you for being with us, and thank you, everyone, for your good service. Ms.